Hi friends, welcome to classes by Lab Doctor. I'm Dr. Divya and in today's class let us discuss about the pathophysiology of gout and the symptoms which can come in gout. So what is gout? Gout is a metabolic disease. Yes, because gout is nothing but it is the deposition of uric acid crystals in the joints. So what is uric acid? It is the end product of purine metabolism. So this gout is a metabolic disease. Usually it is seen in elderly men and postmenopausal women, because in postmenopausal women estrogen is less and the effect of estrogen to lower the uric acid is less, and hence postmenopausal women and middle age or elderly men are more common to develop this gout. So in gout, there is increased body pool of urate with hyperuricemia. There is acute and chronic arthritis which occurs because of this deposition of this urate crystals. And what are these crystals? These are nothing but monosodium urate crystals in the joints and also in the connective tissue, which causes this gout. So gout is basically a arthritis, inflammation of the joint. So how common is gout in India? See, the prevalence of gout in India is around 0.5%. So it is not that much. But what is high is the prevalence of hyperuricemia. Blood में uric acid का level ज़्यादा जो है, that is very highly prevalent in India. But the prevalence of gout is only 0.5%. So North India has a prevalence of high uric acid around 17.4%. South is around 18%. Central part of India around 12.2%. The eastern part of India is around 29.6% and western is around 23%. Maybe because of the food habits, their lifestyle, etc., this could be contributing to the high uric acid level in these geographic areas. Increased production, how it can happen? Because of the increased cell turnover. Cells are lysed. There is tumor lysis, rhabdomyolysis, hemolysis, leukemia, when there is lots and lots of cells which are getting turned over. So increased production of these purines is taking place, and the end product of this purine metabolism is uric acid. So production ही ज़्यादा है. So that is one cause. Second one is increased consumption of purine rich diet, etc. So this gout जो है या hyperuricemia, it is a disease of the kings, because only kings can afford to eat all this seafood and high fat foods, and they can drink beer, all these things. So it is a disease of a rich. So usually what happens is whoever eats this seafood, etc., in large quantities, who have high fatty food, who are eating this meat, red meat, organ meat, etc., consume a lot of beer, consume a lot of sugary drinks, etc., they are prone to develop this hyperuricemia. And also decreased production by the kidney. The kidney, there is a damage. Kidney is not able to excrete enough amount of urine. So that could be because of a chronic kidney disease, or that could be because of certain drugs, etc. The kidney might be damaged, and that may not be able to remove the uric acid effectively, and that can also increase the level of uric acid in the blood. So how do we classify gout? Gout is classified as primary and secondary. Primary because there is an abnormality in the uric acid production metabolism. Secondary could be because of anything, because of certain diseases, like it could be leukemia, pernicious anemia, hemolytic anemia, polycythemia. So when it is because of some secondary cause, this is called as secondary gout. When there is any defect, like in Lesch-Nyhan syndrome, there is a genetic abnormality that itself is causing uric acid, that is called as primary gout. We also have different types of depending upon the progression of the disease, how the disease progresses. We classify gout as asymptomatic hyperuricemia, acute gout, interval gout, chronic tophaceous gout, pseudo gout. So this is how the disease progresses. We can classify the gout into such categories. Now let us see what causes this gout? So the basic pathogenesis of gout depends upon, first would be the development of hyperuricemia. There has to be increased uric acid level in the blood. So that is first thing. Second thing is, once this uric acid is formed, it should form the monosodium urate crystals. And third thing is, when there is an interaction between these monosodium urate crystals and the inflammatory system, when they both have a war, उस time में you will start getting gout. So the hyperuricemia cascade is, one is increased urate level. The hyperuricemia should be there, more than 7 milligram per deciliter in men and more than 6 milligram per deciliter in women. That could be because of diet, tissue nucleic acid, endogenous purine synthesis, overproduction, and it could be because of an under excretion. There is a damaged kidney, so that can cause hyperuricemia. So I have told you this hyperuricemia can cause silent tissue deposition. There will be no symptoms at all. It can cause manifestation like gout. It can cause renal manifestation, cardiovascular manifestation, brain manifestation, insulin resistance, heart issues, diabetes, obesity. All this can develop because of hyperuricemia. So there is increased uric acid now. This increased uric acid level in the blood will react with the sodium, and this forms the crystal. So this sodium crystals, this will be deposited in the tissues and in the joints. So this monosodium urate crystals are formed. So the urate will act with the sodium and they form the MSU crystals. And once these MSU crystals are formed, now the war starts between these and the inflammatory cells. So once the inflammation begins, there will be these soldiers like granulocytosis happening, there will be phagocytosis happening, there will be generation of free radicals, there will be free radical damage to the tissue. That all will cause release of proteolytic enzymes, etc., release of lactic acid, lysosomal enzymes, and because of all this there is destruction of the joints, and also there will be many symptoms which are related to gout. So this is a joint where you can see that this is a monocyte and this is a neutrophil which is engulfing this crystals, that is a monosodium urate crystals. Once this crystals starts getting deposited here, it will also activate the complement activation. This will all lead to formation of chemotaxis, and the chemotactic factors etc. will be released. So there will be lysosomal enzymes, free radicals released, there will be reactive oxygen species, protease will be activated, prostaglandins will be released. So all this will cause soft tissue injury and inflammation. So there will be basically a inflammatory war. So there will be lot of inflammatory mediators released which will cause this soft tissue damage. So this uric acid starts forming the crystals. The uric acid forming crystals also depends upon many factors: the increased uric acid levels, the pH, the temperature, the level of calcium, the chondroitin sulfate, local trauma. All this will help in the formation of these crystals. Just because your uric acid level is high, you will not end up in developing gout. If at all the uric acid level ज़्यादा है, उसके साथ all these factors are also there which will contribute. अगर pH कम है, temperature कम है, या तो calcium ज़्यादा है, local trauma हो गया है, they will stimulate this nucleation, seed crystallization. So this seed crystallization and seed growth will take place. So this crystal growth, it can dissolve, it can break and we can dissolve it, or what happens is, this crystal growth, it can cause acute inflammation. It can have a war with the inflammatory cells and we might start getting acute inflammation. This crystal growth can start depositing in the tissues and that can lead to chronic inflammation. So here you will see that the pH, the temperature, the pressure, all this will have an effect on this crystallization. So this is gout. Here I've told you that this is the deposition of this monosodium urate crystal. So you can see this crystal starts getting deposited. Increased uric acid will combine with the sodium in the blood, and these small MSU crystals will start depositing, and once they deposit, this inflammation will start, and that will cause a havoc. So usually it is the proximal interphalangeal joint of the first toe, that is in 90% of the cases, this is the area where this deposition takes place. So here also you can see on the joint surface how these crystals are deposited. This is the monosodium urate crystals which are deposited on the joint surface. So I have told you hyperuricemia will cause precipitation of the urate crystals in the joints. So ये जो urate crystals है वो joint में deposit हो जाते हैं. Once they deposited in the joint, क्या होता है? Inflammatory switch on हो जाता है. The body will say that oh something is wrong, ये कुछ और आ गया है, we have to act. So the soldiers will start attacking. So the complement activation हो जाता है. Once the complement is activated, the neutrophil come there. Neutrophil को attract करते हैं these crystals. So because of these crystals, neutrophils will get attracted. There is neutrophil chemotaxis. Neutrophil will go towards these crystals. So they start eating these crystals. So they start removing the crystals. They know that this is not supposed to be here. So they start cleaning the crystals. So they start eating it. And this this neutrophil will be lysed. After a certain time, this neutrophil will be lysed, and there is release of this lysosomal enzymes. Also, when they are phagocytizing this crystals, there will be release of prostaglandins, free radicals, inflammatory mediators, etc., which will cause tissue damage, tissue injury, local inflammation, etc., which will be responsible for the symptoms of the gout. Also, these crystals will be phagocytized by the monocytes. Monocytes also release certain factors like tumor necrosis factor, interleukin 1, interleukin 6, interleukin 8, which also releases certain proteases, and they can damage the joint spaces. That leads to the deposition and inflammation of the joints. So this is, you can see here the proximal interphalangeal joint, and you can see how reddened it is. It is so red, inflammatory. Patient will have severe pain as if someone is hitting them with a hammer. So there will be so much of pain because of this acute inflammation. So I've told you that this arthritis is an inflammatory arthritis, and inflammatory arthritis we have rheumatoid arthritis, psoriatic arthritis, and crystal induced arthritis. So crystal induced arthritis is this uric acid arthritis. So now I've told you that it is an inflammatory arthritis. How do you know that this is an inflammatory arthritis? Because you have symptoms of inflammation. You have swelling, you have erythema, it is warm, there is stiffness here. So there is the markers of inflammation, ESR and CRP are raised. If you take the synovial fluid and examine, the WBC count will be very high, more than 2000. So WBC count will be high. All this will happen in inflammatory arthritis. Whereas in a non-inflammatory arthritis like osteoarthritis or because of some neoplasm, we don't get all these symptoms. So this is an inflammatory arthritis, like whenever there is a gouty deposit or because of some infection, etc., what happens is you will get all symptoms of inflammation, rubor, calor, dolor, tumor. So you'll get all this. There is restriction of the movement. Patient will have morning stiffness. The morning the joint feels very, very stiff. When you see laboratory wise also, there are all signs of inflammation. Patient will have high ESR, high CRP, WBC count is high. So this is an inflammatory arthritis. I've told you patient will have in the big toe, he will have pain, he will have swelling, redness, skin over the swelling will be shining. Patient might have fever, nausea, vomiting, etc. So I've told you that this is a crystal induced arthritis because of the deposition of these uric acid crystals. So here the crystals are monosodium urate crystal. In pseudo gout you have pyrophosphate crystals. So pseudo and P. So there is calcium pyrophosphate crystals. Then you have calcium hydroxyapatite crystals, which was earlier called as pseudo gout. So these are the various example of this crystal arthritis. So this is a gout and this is a pseudo gout. So here in gout you will see that this is monosodium urate and this is calcium pyrophosphate. This is needle shaped crystals. These are rhomboid shaped crystals. These are negatively birefringent, whereas these are positively birefringent. So pseudo gout, you can remember the piece. One is it is pyrophosphate, positively birefringent. So here is another picture of this gout, and see, the most common site is this one. 90% you will get in the great toe. So this is the most common site, and less common would be your your knee joint, your ankle joint, your feet. You might also get in the elbow. So the least common joints would be your shoulder joint, wrist joint, fingers. They are least commonly affected in gout. You can have all these joints involved in gout, but the most common is this. The least common would be your shoulder, your finger and your wrist. Main symptom is the pain in the big toe. This is the classic sign of gout, and here the patient complains of this pain which involves this big toe. No doubt that any other joint can be involved. This joint is the most common joint which we see which is involved in gout. Majority of the time patient will complain of severe pain, so much so that even if the bed sheet touches this area, the pain will be so severe that he cannot tolerate that pain. The intensity of the pain is very high. Patient feels severe pain, and this pain usually strikes in the middle of the night. The gout flare up usually happens at night compared to daytime, because at night time the dehydration can trigger the rapid rise of uric acid level in the body, and then you can get an attack. Sometimes you will get this redness, the shiny skin, there will be swelling, etc. There will be rapid intense flare-ups, and gradually the pain also will come down. So gout comes as flare-up. Suddenly the patient will get an attack, there will be an acute attack. Then after some time, after taking medicines, etc., he will be perfectly fine. Later on, because of certain triggers, patient had a case of beer, or patient had a very high diet containing purines, that might again trigger a uric acid deposition and again a acute attack of gout. So patient sometimes develops this tophi. If this gout is ignored for a long time, then these uric acid crystals, they might get deposited under the skin also, and they form the nodules, because it is not only the joints, they also start damaging the smooth muscles also. So the ligaments, the joint, the skin, etc., also starts getting damaged, and then they form these bumps. These are called as tophi. And also I have told you, this increased uric acid can also deposit in the kidney, and patient might even complain of kidney stones. So the pathophysiology of this gout, remember, it depends upon hyperuricemia. There has to be hyperuricemia, either by food intake or by cell breakdown. There could be overproduction or under excretion. And once there is hyperuricemia, that is the one which causes kidney damage, soft tissue and joint space damage, and it can also get deposited in other tissues like ear lobes, etc. So patients whoever are there with risk factors, there will be increased uric acid production. This uric acid accumulates, forms the monosodium urate crystals, gets deposited in the joint. That will trigger the activation of inflammatory cells, and because of these inflammatory mediators, there will be damage to the joint, and patient complains of all the symptoms of inflammatory arthritis. So in the next class, let us see what are the stages of gout and how we can manage them. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.